Good afternoon. Thank you for watching our live briefing for Thursday, May 14th. I have some COVID updates for you. Then I'm going to take a few minutes and discuss how the COVID-19 pandemic has affected Westminster Canterbury financially and in terms of the staff impact that this emergency's had on us and likely will have on Westminster Canterbury for a while. After myself, you'll hear from Winley Gravitt, our Vice President of Workforce Services, then Deborah Jacobson, Administrator of Resident Services, and then Logan Augustine from Pastoral Care will introduce our Thoughtful Thursday segment, which today will have a special resident guest speaker for you. But let me start out real quick with the COVID data. To date, we've had 185,551 individuals tested. We've got 27,813 positive cases. That's an increase of a little over 1,000 since yesterday. To date, 3,592 people have been hospitalized. There's been 955 deaths. And the positivity rate, which we watch to see how we're doing in terms of containing and reducing the viral spread, is essentially unchanged from yesterday, but the 14-day rolling average is headed in the right direction. I need to share with you that late yesterday afternoon, we learned that we have an additional staff member who has tested positive for COVID-19. If you're keeping track at home, that would be our 10th case amongst our staff members. Again, thankfully, very thankfully, there is no risk to Westminster Canterbury. This employee is a part-time employee. He's a CNA in the Parsons Healthcare Center. This employee last worked here on April 19th. This staff member works here part-time, but is a full-time employee at another CCRC here in town. As part of an outbreak response at that facility, this employee was tested, and subsequently we learned of the result through that process. Again, there's no risk. This employee hasn't worked here in over 3 weeks. Just to tell you a little bit more, we currently have 2 residents in Parsons who were waiting on test results because they have had a fever. And today we tested a 3rd resident in Parsons who's also spiked the temp. That's pretty normal. We've had 1 or 2, sometimes 3 individuals in either Parsons or assisted living who are showing some symptoms of illness, and so we've had them tested. I think the number in Parsons and in assisted living all together is over 40 cases, tests that we've had run, just out of an abundance of caution. Nearly every day, we're testing either a staff member or resident to stay in front of this virus. As I said, we've had 10 employees test positive so far. And to date, just to put that into perspective, we've tested 78 staff members as of today. So the point is, the risks here are not going down yet. We do expect they will, but every day there's new situations where we have to either test someone or learn about a new case. Now, I know there's a lot of discussion amongst the residents and amongst us as staff and amongst families about the governor's plan to reopen parts of the Virginia economy. I just want to make it clear, Westminster Canterbury, the management team, the incident command team, we are not ready today to share our plan for a phased reopening of our programs and services, nor are we ready today to talk about the timing for when restrictions on leaving campus will be loosened. We are working through those details of the plan with the different departments involved, but as you would expect, it's complicated, and we need to mitigate the risks as best we can. And this is risky to loosen a series of systems that are working pretty good. We're taking some risks, so we want to make sure we mitigate as many of those as we can. We hear from some of you that you're eager for us to reopen. But we also hear from many, many of you, and the vast majority, who want us to take it slow, want us to be careful about how we do this and maintain the precautions that are in place. So we need to do it right, and we need to communicate it fully before we implement it, and we're not there yet. So I hope, and we're working as hard as we can to have the details of our planned reopening of our internal services and how we'll phase opening the campus up to leaving campus and ultimately to visitation for you later next week. It'll probably be late in the week next week. All right, so next up, I want to spend a few minutes and update you on how the COVID-19 pandemic is affecting Westminster Canterbury financially and as it relates to our staff. As you would expect, and I'm sure you understand this, Westminster Canterbury Richmond is experiencing both revenue, cost, and occupancy pressures. Many of our independent living move-ins of people who were scheduled to move in have been delayed. They haven't canceled, they've just delayed. We're confident our move-in rate will improve as our community, Westminster Canterbury, and the broader community begins to reopen. But consistent with what we're seeing nationally, we're anticipating at Westminster Canterbury that our occupancy in independent living will decrease more or less 1 percentage point per month. And so we're anticipating ending this fiscal year, ending September, 4 to 5 percentage points lower occupancy than where we were in February. Our leadership team, the full management team, is working on working to better understand what the fiscal impacts are associated with reopening programs and services. That is going to have an impact on our cost structure and some revenue probably, but mostly costs. So we're working through those things. Thankfully, and I say thankfully and I mean it, our organization's efforts to contain the virus so far have been very good. That's really the best thing we can do to control our cost structure, because how goes the response to the virus goes our costs. If we have an outbreak, the costs will be significant. So we're going to continue to maintain a very high level of surveillance to mitigate that risk of an outbreak. We have to go through the effort to create contingency planning that this COVID situation will have a prolonged impact on our campus, and that it doesn't just go away, but it lingers. We hope that doesn't happen, but we need to be prepared that that might. So as we do that, if it were to linger and be a prolonged event, it would seriously impact and impair our ability to refill units as people transition or pass away. We expect that the expense or cost pressures from the increased demands of meeting the new regulations and the health department guidance, as well as the costs related to the infection control protocols and personal protective equipment, they're going to continue for some time. We don't know how long, but it's going to be for some time that we're going to have to maintain this higher level of rigor around infection prevention, and it comes at a cost. 2 weeks or so ago, I mentioned that a large CCRC in Maryland, very similar to Westminster Canterbury, a little bigger than us, but very similar, was dealing with a very serious outbreak that they'd had amongst their independent living and ended up in their healthcare. At that point, 2 weeks ago, they were about 2 weeks into the event of this outbreak, and they had spent nearly $300,000 on personal protective equipment. And they were just getting started. It's going to go on for a couple of months. So that's what we're really working to avoid. But it does force us to think contingency planning, because if we do have an outbreak, and it's possible we need to be prepared for that. So For these and many other reasons, this pandemic has caused financial disruption to the way we do business. We expect that our financial indicators, the net operating margin, which is our indicator of how we're performing from an operations standpoint, and our debt service coverage ratio, which is essentially how our cash flow performance, we expect both of those indicators will come in well below plan. There are staffing costs that have been reduced. I'll speak more to that in a minute. We've reduced our capital project spending, and our vibrancy project, the expansion project, has been paused. We're going to begin planning on how to restart that at some point soon, but at this point we've put all of that project on hold for now. These measures will hopefully help us from having to make more difficult decisions later. Westminster Canterbury Richmond has been lucky. We did receive a focused limited grant of $860,000 from CMS. It is there to help us mitigate some of the costs associated with responding to the COVID situation. And so we'll continue to look to that to help us, and we're very grateful for CMS. It's based on our number of healthcare beds that we got that, so we're very thankful for that. So what's ahead? What is it going to look like in this new normal on the other end of this pandemic? Well, to be honest, our forecasts and our outlooks are very fluid, and significant changes in the roadmap materialize about every 2 weeks. So whatever we think the future is, it changes. We are cautious, but we're optimistic that our business, Westminster Canterbury business, and our sector will come back very strong. But as you know, because we were here and we lived through it, we've been at the very front edge of this crisis since the beginning, and it will likely linger in our business longer than most other businesses because of the heightened vulnerability of you all that live here. And that's going to have pressure on our bottom line. There's just no other way to say it. So now let me shift gears and talk briefly about how this has impacted our workforce. As a staff, by and large, all of us, we know we're very fortunate to have a job and to continue to work. A huge number of people have been furloughed or laid off in all businesses, including healthcare. None of us wish for that to happen here. To adjust to the costs and workflow impacts of the pandemic, we've had to adjust how we work and consider the impacts of all that must be done weigh that against the company's financials. The first step we took it very early on in the first week or two of the crisis, is that we made a decision to eliminate a portion of all of the executive staff and director level compensation. That was the first thing we did. Then we followed that up with, we implemented part of our annual increase. April 1st, staff got a cost of living increase because, well, they deserve it and we needed to do it. But as the weeks wore on, we began to settle into this new routine, this new normal that is right now, and it was evident that the crisis was having a significant impact on our operating budget. Many departments around campus are not operating as normal, and some, example being the CDC, are not open really at all, except for a limited number of staff kids. We had staff working in various areas to help stand up all kinds of new processes, and it became apparent that we needed to make some changes as to how the staff were working. As a team, we made a decision to reduce hours across the organization. That reduction in hours impacted roughly 265 employees. 40-hour staff went to 32 hours, and part-time staff all went to 20 hours. I assure you this was not an easy decision, nor one we took lightly. This is what's necessary in order for us to protect employee jobs in the long run. This has been and continues to be a very fluid situation. As we need more hours, we'll bring people back, and that's happened in a couple departments for periods of time. We've needed staff to come in and help, and so we brought them back up to 40, and then we'll reduce them back down. We know this is hard on staff, It's hard on all of us, but it's part of the cost of coming out the other side of this successfully and while protecting as many jobs as we can. We have done some things to help staff, and we provided a number of resources to help them through this. Some examples: we've waived the cost of all COVID-19 testing. Like I said, we've tested 78 employees so far, and any treatments. Thankfully, we thank the Lord for this. Not had anybody with significant hospital bills or extended stays, so we're thankful for that, and it's been to the benefit of the organization. We've certainly encouraged our staff to utilize the WEAVE program if they find themselves in a particularly tough time. We're allowing staff to use their 403B retirement funds and the ability to suspend whatever loan payments they have if they are having a hard time making those payments. And we encourage our staff to use our employee assistance program to help them with the stress. Now, as we stand back up our operations, we're going to continue to closely monitor our workflows in order to ensure that we have the right number of employees at the right place at the right time. There will be a need for us to ebb and flow some hours as we bring things back online. We expect that. Our ultimate goal is to be able to maintain employment, maintain safety, and ensure that Westminster Canterbury is here for the long term to serve you and future generations. It is a delicate balance, and it's not an easy task, but we're committed to figuring it out. And I want to thank you for your understanding. I know staff are watching, and I appreciate their willingness to come to work and accept these changes that we've had to implement. And I thank the residents for understanding that we have to do it. It's just part of managing a business through a crisis, and that's what we're in right now. So thank you for your time. That's it for me. I'm going to invite Winley Gravitt, Vice President of Workforce, up to speak to you next.
Good afternoon. I wanted to come up and share some good news with you this afternoon. You may have seen the article in the May 12th version of the Richmond Times-Dispatch about Jasmine Mason. Jasmine has been working in dining at Westminster Canterbury since last June. Jasmine is also the daughter of Clara Mason, who's also a dining services employee in our Parsons Health Center and a 2019 Hall of Fame winner. Jasmine happens to be quite the artist and has won the National Gold Medal Portfolio Award as part of the Scholastic Art and Writings Award. This is a major national award that comes with a $10,000 scholarship for her to continue her studies. Congratulations, Jasmine. We're very excited and proud of you. I also wanted to take a minute to thank our residents. As many of us were leaving yesterday afternoon, we were greeted along the driveway with residents holding up signs, cheering and clapping for us as we finished our day. It was truly touching and a wonderful way to end the day. If you missed it, we captured some video that is running a few times a day on TV 971. Thank you so much for your praise and your thanks. It continues to help us push forward and keep us uplifted during this difficult time. And up next is Deborah Jacobson, Administrator of Residential Living.
Good afternoon. I too want to thank you so much for the exit we had yesterday as we were leaving work. I joked with some of the residents that when John Burns calls you and says, Deborah, go outside and see what's happening, I didn't know exactly what was going on, but was thrilled to see all the clapping and all the smiles. It means so much to us, and again, I want to thank you for that. I also want to thank you for all of the thank you notes that I've received in reference to the Mother's Day bags that were placed on your doors. I want to give credit to Whitney Woodward and all of her staff volunteers that not only put those together, but also put them on everybody's door that Friday afternoon. So again, thank you all for that. A couple updates for you about the absentee ballot applications. As you start to receive those ballots for the dual primary election scheduled for Tuesday, June the 23rd, please note that the witness is no longer needed. It is no longer required to fill out this ballot. Directions with those types of changes are included in that ballot. If you previously submitted an application and marked it general election or Democratic primary, you should have received a new application to fill out indicating that you would like to vote for the Republican primary, as that is the only election happening within our district. If you choose to fill out the new application and send it to the Henrico County Registrar's Office, you will receive a Republican ballot within 2 to 3 days. If you have any questions about this, please contact Emily in the Resident Services Office at 6082. I know we kind of lose track of time, but believe it or not, we're coming up on a Memorial Day. Memorial Day is Monday, May the 25th. I would just like to let you know ahead of time so you can plan. There will not be any grocery delivery from Publix that day or family drop-off at Azalea. I'm telling you ahead of time, hopefully you can contact your families and everybody will know that we will not have those services available on Monday, but everything will start back on Tuesday with the family drop-off on Wednesday. Lastly, I'd like to talk to you about some of our responses to your questions and requests for services. As we started off with the COVID-19, there were lots of services that we had to change around and deliver in different ways. Those things included your meal delivery, your mail delivery, your grocery shopping, and etc. Now we're progressing into an even more complicated issues. Some of these issues impact just a few people, and some impact quite a few. The needs of your pets is one example of what's happening now. We're having to make decisions to help you out with your pets and develop a solution that allows for the fewest opportunities for our residents to be exposed to the outside community. We know at times not everyone agrees with the decisions that we're making, but please have trust in us as we're trying to keep you and all our residents healthy and safe with the least amount of exposure. So with that said, please give me a call if you have any questions, and I look forward to talking to you next time. Logan is up next.
Good afternoon. I'm Logan Augustine, one of the chaplains here at Westminster Canterbury. Thank you for joining us for Thoughtful Thursday. During the pastoral care segment for our Thursday video updates, our resident clergy are joining us to offer a reflection and prayer. So today we welcome Reverend Canon Bob Hetherington. Bob is a resident here at Westminster Canterbury and a priest in the Episcopal Church, and we are so lucky to have him as a part of our community. I would like to invite Bob forward to share a reflection and a prayer.
Good afternoon. My inspiration for this time comes from the first verse of the 14th chapter of the Gospel according to John. Jesus said, "Let not your heart be troubled. Believe in God, believe also in me." Troubled hearts. This is a time of troubled hearts, this time of COVID-19. Our lives have been disrupted in all sorts of ways. It's hard to make sense of it, and we don't have any real sense of where we're going to end up. Certainly life is going to be different. But we have a lot of feelings of anxiety, fear, that are part of our life experience now. And there are all kinds of ways that we experience that. In terms of this community, it occurred to me, in one sense, people have become the enemy. We wear our masks. We're in danger of infecting each other. And that's a real fear and an attitude about the other person that we've never really experienced before. When Lolly and I moved into Westminster Canterbury almost 15 years ago now, we moved in at a time when the courtyard apartments were brand new. And the idea was to try to merge the community together. There was a fear that with the community increasing so significantly that we would never become one community. And so we had a couple that mentored Lolly and me and invited us to all kinds of events and brought us together in so many different ways and brought all kinds of people together to build this sense of community, the new sense of Westminster Canterbury as the courtyard came online. And I compare that welcome that we had all those years ago to the welcome that a couple have now in moving in. Welcome to Westminster Canterbury. If you're a new couple, the first thing you get to do is be quarantined for 14 days in your apartment because you're a risk to us. And that certainly troubles our hearts and makes us anxious. And I can't imagine what it must do to you who are a new person here, going through a huge transition in your life with all the anxieties and uncertainties there, and you're welcome to a new community that you hope is going to be a good place, and eventually it will be a good place. But your initial welcome perceives you as the enemy. We don't want you to put you at risk. Our hearts are troubled. But the antidote is to have faith. Let not your hearts be troubled. Believe in God. Believe also in me. Believing is what pushes us forward, which helps us cope with the fear and the anxiety. It is faith that gives us hope in the midst of things we don't really understand. And we need to spend time developing that faith, pressing toward it, saying our prayers, taking time for personal spiritual reflection, trying to keep our spirits in the best possible shape because of all the things that trouble our hearts. All of us are giving up certain things in this time. And it's hard to maintain life the way it is in shutdown. What are the things that you're giving up? Here I am, a 2-minute walk away from my wife who's in health care. The last time I saw her was almost 9 weeks ago, and because of her disabilities, we do best when we're right together. And that hasn't been possible. In fact, the last meal I had with somebody else was a meal that I had with my wife on Wednesday, March the 11th, the last time I was allowed to go to health care. So it is a sacrifice. Certainly I've had some FaceTime with Lolly. I know she's being well taken care of and all of that, but it's hard, this social isolation. And my story is not unique. It's true for everybody in the place. But the point about faith is it gives us the strength to lean in, to accept the personal sacrifices that we make for the good of the community. And when I look at it through the eyes of faith, it gives me strength and encouragement to keep on keeping on. One day we're going to get through this thing, but it's not tomorrow or the next day. And so we need to be strong in our faith. Jesus said, "Let not your hearts be troubled. Believe in God. Believe also in me." May it be strong. May we be safe. May we develop those personal faith resources that each one of us needs for this time. Please pray with me. Lord, we give thanks for the gift of today. We give thanks for the fact that the senior staff are keeping all of us safe. Help us to cope with the things that trouble our hearts, and to discover in the midst of our troubled hearts that you are present with us, giving us strength, encouragement, hope, things that we need to press on with our lives. We give thanks for all the people who are working so hard to make Westminster Canterbury the special place it is, especially now in this time of uncertainty, of fear and anxiety. Lord, continue to bless each of us and help us to go forward in a good way, a safe way, a faithful way. And all God's people said, Amen. The update will be offered again tomorrow at 3 o'clock. Thank you.